Presymptomatic SARS-CoV-2 infections and transmission in a skilled nursing facility. Definition: presymptomatic transmission was defined as a transmission of SARS-CoV-2 from an infected person to a secondary patient before the source patient developed the symptoms and a certain by exposure and symptoms on set date, with no evidence that the secondary patient had been exposed to anyone else with COVID-19. Application in medicine. Typical COVID-19 signs and symptoms include fever, cough, and shortness of breath. Potential atypical symptoms as include sore throat, chills, increased confusion, rhinorrhea or nasal congestion, myalgia, dizziness, malaise, headache, nausea, and diarrhea. Facts: presymptomatic transmission might occur through generation of respiratory droplets or possibility through indirect transmission. Speech and other vocal activities such as singing have been shown to generate air particles with a rate of emission corresponding to the voice loudness. Environmental contamination with SARS-CoV-2 has been documented, and the possibility of indirect transmission through fomites by presymptomatic persons is also a concern. Objects might be contaminated directly by droplet or through contact with an infected person's contaminated hand and transmit through non-injurious agent practice. Issues applied in Ecuador. In Ecuador, the majority of the patients are asymptomatic and undiagnosed. This occurred because there were not enough tests at the beginning. Nowadays, we have rapid tests, but these are not 100% specific and may even have many failures. Pros and cons. Pros: as they are asymptomatic patients, they will not have a fulminant disease, they will not have serious symptoms. It means that they will have a good quality of life. They will not need hospital care. They will be able to stay at home in social isolation until they have recovered. Cons: the patient having no knowledge that he is infected, he can become a danger to other people because he will not take precautions. This patient can transmit the virus through secretions such as tears, saliva, and mucus. Video of a news by CGTN.
On Sunday, Central China's Henan province reported one locally transmitted case and two asymptomatic patients. Previously, most provinces had gone 30 days with no increase in locally confirmed cases, and in many new cases were imported ones. Suddenly, fears of a new outbreak started to spread. So what is an asymptomatic case? Asymptomatic means without symptoms. The patient will test positive but shows no clinical symptoms such as fever and cough. The question worrying people is, can asymptomatic patients infect others? The answer is yes.
The virus could stay in the bodies of some of those asymptomatic patients for over 3 weeks. If one comes back to China from overseas and comes into contact with others in his or her third week, that would cause huge transmission risks.
However, the good news is, according to the WHO, the disease is mainly transmitted by patients with symptoms. Earlier, China's top COVID-19 expert Zhong Nanshan shared his view.
So I suppose we don't have too many asymptomatic patients. If so this kind of patient will be transmitting to other people, so making the number higher. But now, actually, it's going down.
China's health authorities are keeping a close eye on those who have close contact with the COVID-19 patients but show no symptoms. They are imposing quarantine on potential asymptomatic cases and ordering nucleic testing twice for them.
I'm sure all of you have heard already that there is a patient with a positive test for coronavirus, but he is actually asymptomatic. Or like, there is this patient with a mild case only. There is this patient with a moderate case. That one is severe. The other one is critical. So what is it all about? Let's try to understand better the COVID-19 classification in terms of severity. We may need this one. Alright, so let's try to break this down. We've got asymptomatic cases mild cases, moderate, severe, or critical. So the most common cases will be either asymptomatic or mild. And then sometimes the disease may evolve for a moderate and then a severe and critical case. So when it comes to moderate, severe and critical case, the most vulnerable groups to develop it are people older than 60 years old, or even if they are older than 70, even more likely they are to develop one of these three last scenarios. People that present any heart disease, lung disease, cancer and is receiving treatment for it, immune deficiencies, or people that got a transplant, organ transplant. But let's see first the most common scenarios. So, first of all, asymptomatic cases. What does it mean? Asymptomatic means no symptoms at all, without symptoms. So, no fever, no dry cough, no sore throat, nothing. How many symptomatic cases there are? We don't know yet. But early research has shown that it might be 40 to 50% of the infected cases. About half of the population might be asymptomatic. In order to understand really how many people is asymptomatic, we would need to run antibody testing, do a quick scan through all the population and understand how many people is positive, didn't have any symptoms. However, I just got this here because some asymptomatic people may have a loss of sense of smell. So there are some indications that some people might not have any other symptoms apart from a lost sense of smell, and we consider still them asymptomatic. Then the mild cases. To start with, let me just add that normally the virus affects mainly the upper respiratory tract, so just the large airways, so the symptoms will be flu-like symptoms. Patients may have fever, and normally this fever will even be a mild fever, it might not be higher than 37.8 degrees. People may lose sense of smell again, may have tiredness, muscle pain or headaches. They may not have a sore throat or a runny nose, but in some cases they may present sore throat and runny nose. And a mild case normally lasts for about 7 to 10 days, and also about 81% of the symptomatic cases are mild cases, and then people get better. However, some patients may not resolve it, and they may feel like trouble in breathing, which means the infection is reaching the lungs. And then that's when we enter the more severe cases. So the moderate, severe, and it can even get to critical cases. That's it. I hope it made sense. If you like this video, give it a big thumbs up, subscribe to the channel, I'll keep you updated. See you soon.
Video by Free Med Education.
Day-to-day symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patients show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
Video by Kirsty Resigen.
Hi, and welcome to another edition of Your Health with Dr. Christy. I'm Dr. Christy Reisinger, and today we're going to talk about asymptomatic COVID-19. What does asymptomatic mean? Asymptomatic means someone that doesn't have any symptoms. So can someone have COVID-19 and have no symptoms? Yes, they can. There have been several studies that have come out that have shown this to be true. And there are also some interesting case studies from the United Kingdom about patients losing their sense of smell and losing their sense of taste. Now, these are case studies, so that means we don't have a lot of data, but it is interesting nonetheless. So if you live with someone who has a positive COVID-19 test or is exhibiting symptoms of COVID-19, and you suddenly lose your sense of taste or your sense of smell, but you don't have any other symptoms at all, you may be an asymptomatic carrier of COVID-19. Well, what does this mean for you? This means you can pass COVID-19 on to someone else, possibly for up to 3 weeks. And we also know that even if you're an asymptomatic carrier, you can still pass on the full strength of COVID-19 to someone else. Just because you don't have symptoms doesn't mean that you're carrying a less or weaker form of COVID-19. You're carrying the same strain, so be very careful. Well, what should you do? I know that's very concerning to think about. Once again, I would still recommend the same things that we're doing now: social distancing and washing your hands. However, if there is someone in your house who is exhibiting symptoms of COVID-19, such as fever, cough, and fatigue, even if they haven't gotten a positive test, you should also be concerned that you may be also positive for COVID-19 and simply not having any symptoms. If you're an asymptomatic carrier for COVID-19, there's nothing special that you need to do. You don't need to take any special medications. You don't need to consider antivirals. You don't need to take Tylenol. The best thing that you can do is to continue to maintain social distancing and wash your hands. Thanks again for joining me.
Conclusion. To conclude, coronavirus disease has radically changed our lives. It has forced us to change our lifestyle, and now this disease that at first seemed so small has become a silent disease. This means that now the disease not only kills full its severe symptoms, there is also a group of people who have now symptoms, making these asymptomatic people a bigger danger for healthy people. It is an even bigger problem since in most of countries there are not enough tests or through tests to diagnose who is asymptomatic, symptomatic or not yet infected. Thank you.